Okay. Good afternoon, guys. Now, today's C deals with elder safety. Okay, for elderly folks, we're talking when their balance gets unsteady and things of that nature, falls, injuries. I'm going to go through that for you in a presentation I made for you. Please sit back and enjoy the presentation. Here we go. The Dear Abby column you're viewing centers on a painfully common dilemma. An older adult daughter watching her aging mother repeatedly fall, deny the seriousness of those falls, and reject the very tools that could help her be safe, keep safe. The surrounding page content paints a vivid picture of fear, frustration, and the emotional tug of war between autonomy and safety that that so many that so many families face. What the page describes in depth. The letter writer uprooted her life nearly a decade ago to be closer to her aging parents who are now in their early to mid 80s. Recently, her mother has had multiple falls, including one so severe she needed ambulance transport to the ER because she couldn't stand afterward. The detail alone signals a major shift in functional ability. The kind of event clinicians consider a red flag for escalating fall risk. The daughter suspects that alcohol at casinos, even a drink or two, may be worsening her mother's balance. Alcohol's impact on gait. Reaction time and judgment is magnified in older adults, especially when combined with age-related changes in muscle strength, vision, and blood pressure regulation. After nearly a year of urging her mother to use a walker, the daughter finally bought one herself, brought one herself along with a shower chair, but both parents insist she doesn't need it. The mother even went back to the casino without the walker, despite having just required help to stand and walk in the hospital. The daughter's tone is raw. She is beside herself, terrified that the next fall will mean broken bones or worse. How to understand what's happening. The surrounding content frames this as a classic collision of denial, pride, and fear. Autonomy versus vulnerability. Many older adults resist mobility aids because they symbolize them with decline. A walker can feel like an admission of frailty, even when it's the very thing that preserves independence. 2. Clinical risk factors. The mother's pattern, recurrent falls, impaired balance, alcohol use, and an ER visit signals high fall risk in geriatric care. One of one of one fall with injury is enough to trigger a full evaluation. Multiple falls raise the stakes dramatically. 3. Family dynamics under strain. The daughter's decision to buy equipment on her own shows love and urgency, but the parent's refusal suggests deeper emotional resistance. It's not that they don't hear her, it's that they can't yet accept what the walker represents. Okay, guys, practical next steps implied by the page context. While the column itself is brief, the surrounding content points toward several evidence-based strategies. Seek a comprehensive fall risk assessment. A primary care clinician or geriatrician can evaluate balance and gait, medication interreactions. Give me 1 second, guys. Blood pressure changes, alcohol use, muscle strength and neuropathy, home hazards, a professional's voice often carries weight that family members pleads do not. Reframe the walker. Instead of presenting it as a sign of decline, frame it as a tool for independence, a way to keep enjoying outings like the casino. A temporary support while strength improves. Involving the mother in choosing the style or color can also help restore a sense of control. Consider a home safety evaluation. Occupational therapists can recommend small, dignity preserving changes that reduce risk without feeling intrusive. Address alcohol gently but clearly. Even small amounts can dramatically increase fall risks in older adults. A clinician can help navigate this conversation without blame or shame. Why this is urgent. The combination of multiple falls and ER visits, refusal of mobility aids Continued outings without support creates a high risk scenario for fractures, head injuries, or hospitalization. In older adults, a single serious fall can trigger a cascade of loss, mobility, independence, and sometimes even life expectancy. Okay. If you'd like, I can help craft a compassionate script for talking with your parents, a checklist of questions to bring to their doctor, a short evidence based explanation of why walkers increase independence rather than diminish it. Okay, guys. So here we go with the second half of the show. Give me 1 second, please, and I'll be right with you. Okay, here we go with loss of balance as a problem rooted primarily in vestibular dysfunction, a disruption in the inner ear, the brain, or nerve pathways that help the body understand where it is in space. It emphasizes that balance is not a single system but a network of sensory inputs. When any part falters, people may feel unsteady, dizzy, or disorientated. The page also stresses that these symptoms are common, often treatable, and should not be ignored. Common causes the page highlights. The article walks through several well-known contributors to balance problems, grounding each one in simple physiology. Beginning paradox, positional vertigo, or BPPV, tiny calcium crystals in the inner ear become dislodged and shift into the semicircular canals, sending the brain confusing signals about movement. Infections or inflammation, conditions like vestibular neuritis or lab rhinitis can temporarily disrupt the inner ear's ability to relay accurate information. Head injury or trauma, even mild concussions can disturb the delicate structures that regulate balance. Age-related changes, natural degeneration of inner ear cells. slower, slower reflexes, and reduced sensory input make older adults more vulnerable. Underlying diseases, neurological disorders, chronic conditions, or structural problems in the ear can all impair balance. The article frames these causes as common and often manageable with the right evaluation and care. Typical symptoms described. The page provides a broad picture of how vestibular dysfunction feels, noting that symptoms often cluster. Dizziness or vertigo, ranging from mild unsteadiness to intense spinning, nausea and vomiting, especially during vertigo episodes, lightheadedness and headaches, which may accompany sensory disruption, okay, visual disturbances such as blurred vision or difficulty focusing, hearing changes including muffled sound or difficulty processing noise, fatigue and cognitive fog as the brain works harder to compensate. Emotional effects, including anxiety or depression, which can develop when symptoms persist. This holistic description helps readers understand that balance issues can affect both body and mind. Treatments and interventions the page recommends. The article emphasizes that treatment depends on the cause, but that many people improve with targeted care. Medical evaluation to determine whether the issue stems from the give me 1 second, guys. Inner ear, the brain, medications, or other source. Vestibular rehabilitation therapy, a specialized form of physical therapy that retrains the brain to interpret balance signals more effectively. Balance exercises and sensory organization training to strengthen stability and coordination. Surgery reserved for rare causes where structural problems require correction. Okay, guys, so that is your C for this afternoon. I'll be back on later with D. Give me a little bit for a break and then I'll be back on with D shortly. But for now, Gator Wellness, take care, folks.